I know that many people have had the experience I had when checking into an emergency room or urgent care facility. When you finally get in the ER, they go right ahead and start administering treatment without giving you any idea of costs. This is just how they're set up to operate. But that way of operating is designed to allow them to pull some very shady business on your bill. Not surprisingly, the bill is loaded with all kinds of fees, charges, overcharges, surcharges, mystery charges, and then some other charges. And most of this is just pulled out of thin air. And then they say, "Don't worry, your insurance will cover it," as if it was free to you. They never mention that your insurance premiums pay for all that, plus the massive overhead of the insurance company, plus the massive overhead of the physician's billing system and personnel. And then you have the problem that you pay for it anyway, because your insurance company has all those exclusions and waivers and denied claims, deductibles, copays. So even though you're paying for insurance, you're not actually covered for a lot of that stuff. However you pay for your health care, if you don't negotiate those services and costs, you will not like the outcome, because the medical industry is treating us like we're ignorant suckers. And to some degree, we have been. As we have chosen to simply pay medical fees without question, we have encouraged the medical industry to continually raise fees to ridiculous levels, especially for emergency care. We've encouraged all kinds of middlemen, like insurers and government agencies, to come in and add massive layers of cost to our health care. We have encouraged researchers, patent holders, and regulators to focus on profits instead of our medical needs and preferences. We have encouraged the medical industry to focus on treatments that don't cure instead of cures that take little treatment. By observing how medical services are structured, it is very easy to see that they don't want to cure anything. They want us on addictive drugs. They want us on chronic regimens of treatment that are loaded with unnecessary office visits, where you may receive nothing but a referral to another physician or something. Perhaps the largest flaw in our medical system is that doctors do not charge you for helping you. They just charge you for their time. So even if a doctor makes you worse off than before, they charge you as if they had provided some valuable service. That's just a straight-up scam. If we're paying for someone's time who is not helping us, then yes, we're suckers. Imagine if you went into the drugstore to buy a bottle of aspirin. You find a small bottle, 20 aspirin pills, no price on it. You take them up to the cashier and they ring it up and they say, "Okay, that'll be $1,200. You say, $1,200? That must be a mistake. The cashier says, "No, $60 a pill, 20 pills, that's $1,200 plus tax." Of course, you say, "Well, I can't buy that. I'm not buying those pills." The cashier says, "I'm sorry, you've already bought them. When you took them off the shelf, you bought them. You can leave them here if you want, but you owe us $1,200. That is exactly how emergency rooms, hospitals, and clinics treat their patients. That is exactly what they do. And we need to stop letting them get away with that stuff. They have conditioned us to think they have some right to charge us outrageous fees for things we do not need or approve. No other industry or marketplace gets away with anything like this. It's not the science of medicine. It's the science of overbilling and getting away with it. It's not the physicians who control medical financial practices. It's the accountants, the executives, the corporate profiteers. The nature of medicine gave them the opportunity to jack prices up and put it in those deceptive practices, because our health and the health care of our loved ones is so important. So we just let it slide. Unfortunately, when our health is at stake, we must be even more careful to not be taken advantage of, because it's so easy to take advantage of us at that time. So I'll tell you a way you can do that. I had a personal experience when I was charged $2,800 for a visit to the ER. Some years later, I had to go to the ER another time. This time, I did one thing differently, and the whole visit cost $250. The only difference was that I handed the front desk a written notice that all charges had to be approved by me in advance of commitment, or they would not be paid. Simple as that. When I walked out of that ER, I wrote a check for $250, and that was the end of that. Now, it's common knowledge that if you pay cash for medical services, you can negotiate a much lower fee for almost anything. But this takes it one step further. Imagine in a situation where you are receiving medical treatment, to be told of each charge in advance and having the option to say yes or no, and making sure in advance that you are not taking on any obligations you can't afford. That's how it should be. When I gave them that notice, that's how it was. Because that was unusual for them. For someone to ask for costs in advance, the ER was not prepared to disclose fees. The back office does that. They don't post their fees on the wall, even though they could easily do that. The nurses and doctors don't even know the fees themselves, and they're accustomed to never thinking about that. So in my ER visit, nobody came to me for approval of any fees. I walked out of the ER paying only the $250, the fee they quoted me for the walk-in visit. I never heard another word about any other charges. Clearly, the ER made a profit on my visit. I didn't take up more than a few minutes of anybody's time. I was only in the examination area for maybe 20 minutes. Supplies used in my treatment probably cost maybe $20. That $250 I gave them was mostly profit for them, but they would have billed me $2,000 or $3,000 if I had not presented that notice. When the greed and injustice has taken over a system like the healthcare industry, we have to do something about it. We have to take action. No one will do it for us. In this case, the action is so simple. Simply hand them a written notice that says, you need to approve all charges in advance. Actually, it's even simpler. We have a free document download of that notice on the homepage at freedomtaker.com. It's crazy for the medical industry to assume we can just pull any amount of money out of a hat. We are not magicians. Your healthcare providers absolutely should know what they are going to charge you and should not hesitate to answer that question or get you that information. And they should do that and get your approval before they provide the service. In some places, it is illegal for any professional to refuse to disclose their charges when they are asked. But even if that's not the case, if you tell them in writing that they won't get paid unless you approve the costs in advance, those are the new rules, and everybody is on notice. The simple act of serving notice changes all the rules, and the serving of the notice is as easy as handing someone a piece of paper, preferably with a witness next to you. You can give the notice to anyone working in the facility, and the notice is served. At freedomtaker.com, we like to offer those kinds of forms to the public at no charge. So just go to our download section on our homepage and click on the file that says Notice to Healthcare Provider, and get your instant free download of the template in Microsoft Word format, which you can edit and revise all you want. We do not collect any data about you or your computer. Freedom Taker is a community-spirited public service helping to protect everyone's rights and freedoms. Make sure you have that notice in your hand when you head for the ER, the hospital, the clinic, or even your doctor's office.